Dr. Barbaro will talk about high-intensity focused ultrasound thyroid ablation. It's from the Hospital of Livorno, from the Unit of Endocrinology. Please, Daniele.
Before all, thank to Roberto Valcavi, a friend of the first hour, for the kind invitation. Ecotherapy. HIFU is a therapy which uses high-intensity focused ultrasound by a transducer to focalize ultrasound toward a target point. The purpose of this is to heat the tissue to about 80 degrees to induce necrosis in the focal point. This is a mobile device of treatment which is made by touch screen, an articulated arm, a robotized head, and a treatment view unit, of course a refrigerating system. Just to see in a special view, in a special way, the treatment and view unit, you can see the membrane with the piezoelectric transducer and the US imaging, which is perfectly lined on the transducer system to have just a perfect line of treatment. This is one of the first papers published by Esnold. In this paper, Esnold could show that the efficacy of HIFU is very good because in this case, Esnold was able to produce both restoration and radiation uptake and decrease of volume of a nodule. Of course, in this case, of a hot nodule. This is another image which shows that the treatment with HIFU can produce a precise line of treatment. So as you can see, the line of the treatment and the area of necrosis is perfectly divided from the normal tissue. Just go again in the technique of the machine and of the treatment. As you have seen, this is the device of treatment. The treatment and view unit is perfectly rest of the neck of the patient. It's perfectly on the neck of the patient. It rests on the neck of the patient. And when you put this on the neck of the patient, on the machine, you can see this image on the screen touch. Of course, is an ultrasound image. And on this ultrasound image, with the finger or with the pen, you border all the structure that you can see. You border the vessel, you border the nodule, you border the trachea, you border the skin. The skin must be smooth. This is very important. After you have bordered all this, on the machine appear another image. And on this other image, you can see all the points. And these points, you can see which part you can be treated and which part that you can be treated. The red part are the part that you can be treated because the part near the vessel or the trachea or near the other special part of the body of the neck, which can be dangerous to be treated, are red because the ultrasound after the target point, of course, go on, can be destroyed, this part. See, this is another example. You can see that red part, which are the part near the trachea. Of course, this part can be treated, and you can treat. You can treat. The software does not allow to treat this part. When you have established, when you have put the unit treatment on the neck of the patient, when you established to treat, you go on and you start the pulse. When the pulse starts, you have an image. I try with this. It's not easy for me, but I try. You have this, and you can see what happens. In this moment, in point of fact, you don't see exactly what happens. This is the period of the pulse. After the pulse, you see the hyperechoic marks. The hyperechoic marks means that the target point is well treated. However, if you don't see the hyperechoic marks, it doesn't mean that you have not treated efficaciously. Maybe that you've treated, but if you see the hyperechoic marks, it's better. The pulse lasts about 8 seconds. This is an important moment because when you start the pulse, you must decide the power of the pulse. So in this treatment, you decide the power, which can be still 50 or less. Again, to see another image, then you see a nodule where you can treat every part of the nodule. Again, the image with all the points that you can treat, and again, the the hyperechoic mark. So this is the technical of the HIFU. Let's go on to see the literature, what we can do, what has been done about HIFU. This one of the first paper of Kurkuzus about published on Internal Journal of Hyperthermia. These are 10 patients, 6 cold nodules and with 4 hot nodules. The volume of thyroid at baseline were 3.2 milliliters, so not so big nodule. We can see quite small nodule. In this patient, were all outpatients, were done local anesthesia without sedation. The purpose of this paper was to describe the effect on HIFU on some blood parameters, and of course, the dimension, the size of the nodule. Regarding the blood parameters, we could see that there was no increase of thyroid hormone, but increase of thyroglobulin after 24 hours. This is the decrease of volume of nodule at about 35%. This is another paper published by Kovacheva in Bulgarian. This paper studied 20 patients. In this, the volume of this nodule was a little larger, about 4.9 milliliters, so again, nodule not so big. In this patient, outpatients also in these cases, in this patient, it was done cautious sedation. The decrease of volume was about 50%, no serious side effects. This is where the parameters of the treatment. These parameters can be a little difficult for who doesn't know, of course, HIFU. I want just to stress that the main point is the energy for volume nodule, which was 3.8, a number, let's say a number. But we have to keep in mind, as I have already told you, that one of the parameters that you can decide at the beginning of the treatment is the power. And the power is the most important parameter to determine the pain of the patient. More is the power, more is the pain. More is the power, more is the energy delivered, of course. So we have every time to do a balance between this. This is the reduction of the volume of the nodule that we can see. It was a good reduction of volume. But in this paper, the power was about almost 50, and in point of fact, the patient that said this as a cautious sedation. This is another paper of lung. In this paper, about 73 patients was we had 3 groups of patients, split in 3 groups with different volume of nodules. What could we see? We could see that depending on the volume of nodule, we could have different percentage of decrease of nodule. We can see group 3 with a large volume, we had a minor decrease of volume. So I am very sorry for this slide, which is not very good, but I want just to see that in the group with larger nodule, we had the minor decrease of volume, and in point of fact, we have the energy of volume, minor energy of volume. And this independently for the power, but we have the larger nodule. Also, if we decide for a high power, we can deliver a so large energy for volume nodule. So pre-ablation nodule volume and total energy for volume nodule were significant determinant for ablation success. One of the conclusions of this author was that for larger side nodule, additional HIFU treatment could be an option, however, instead of doing everything in the same session. This is another example. And so let's go to what we decide to do in Livorno. It's my opinion that these minimal invasive techniques are beautiful when we do with no anesthesia, with no sedation cautiousness. We know when the patient is an outpatient. I like very much this minimal invasive technique when the patients go and after 10 minutes can stay perfectly without no side effects, of course, without no addition of drugs or some other things. In this group of 16 patients, we treat the volume nodule a little larger. We treated with the power of pulse of 2126, which is a low power pulse. The total energy was this, and the time of treatment was 1862 minutes, so a quite long time. The energy for volume, if you remember the previous number, was extremely low, was low, of course, because they decided to use a low energy, a low power, because they decided to use a low power. The side effects, we had no side effects. The patient had no pain. All not functioning nodules, the criteria of inclusion were nodules with a percentage of increase of volume of at least 10% in 2 years follow-up. This was the criteria. Of course, we didn't have a so large decrease of reduction, but we could have patients with no treatment before and during the HIFU treatment. This is the results. We can see the reduction of the nodule at 1 year, which was, in this case, 36%. And if we can see the structure of the echoic structure inside the nodule, there was cystic area, and in point of fact, after 2 years, the nodule were further reduced. So also with power, low power, we can have a good result without pain, without sedation, and without local anesthesia. Now, to go on to the end of my presentation, I want to quote some paper to show some special aspects of these methods. For instance, this paper will confirm what we did in Livorno, intensity focused ultrasound therapy for benign nodule without anesthesia sedation. It has been redone again by the Trimboli, the group of Giovannella in Switzerland. Also in this case, the nodule had a good percentage of reduction without no treatment. The power was a little higher, and the patient, however, experienced a little of pain. In this other paper, interesting, is of the same group of Luca Giovannella, and was a comparison between the intensity focused ultrasound and radioiodine treatment for treatment of toxic nodules. In this case, radioiodine was superior, but they were all toxic nodules. It's my opinion that we use HIFU for nodules with TSH just low normal. When all the gland is not completely suppressed, maybe HIFU is a good option, of course, not for completely hot nodule. This is another paper which I think is very interesting. Intensity focused ultrasound is safe and effective in patients who continue taking anticoagulant platelet agent in treatment, antiplatelet agent. So the treatment is completely closed, so we can go on if the patients do anticoagulant therapy. We have to say also this, the two sequential application of intensity focused ultrasound ablation for large penis nodules. We can do again 2 sessions of HIFU, but I want to say that in this case, sequential application takes longer and requires larger amount and petidine and diazepam. So I think that this really becomes something more like a surgical intervention. And this I don't like for minimally invasive technique. And to finish just to quote this paper, 2 years outcome of single session intensity focus for treatment of relapsing Graves' disease. The 24 months relapse rate was 41%. I quote this, but sincerely, I don't think that this can be really an important indication. So, regarding HIFU, which can be a checklist of indication and contraindication. Indication can be solid nodules with compressive symptoms, autonomously functioning nodule with TSH just a little low, normal low TSH, no completely autonomous functional nodule, no malignant nodules, no intranodular cystic area, but we know that this is not a real contraindication because, as Roberto told us, we can drain the cystic or treat before with percutaneous ethanol injection. No intranodular macrocalcification, because of course the ultrasound must be able to pass inside the nodule. No nodule next to trachea, skin carotid. No nodule next to the posterior side of the lobe. No vocal cord mobility, of course. No disease-preventing neck hyperextension. The patient might be very collaborative for HIFU. No history of thyroid neck cancer. This is still, in this moment, a contraindication. No history of neck radiation. No alteration on the skin, because the unit treatment must be completely completely rest on the skin. This is a paper of, again, of group of Giovannella, which tell us that the use of acoustic power of 5 watt allow to achieve maybe also a temperature for a coagulative necrosis of 50 degrees. This is important because, as I told you, the power is the main point which can determine an non-bearable pain. This, I think that we must play with the power when we decide to try to with that. So to finish, we go to the conclusion. HIFU is a non-intrusive alternative among the minimally ablative invasive techniques because, of course, we have no needles. The decrease of volume of nodule is related not only to the final energy delivered, but also to the power of the pulse. However, measures is the power, the watt, measure is the pain. So continually a balance you must do. Regarding power, so a balance between volume of nodule, amount of obstruction desired, and functional state must be done. This is the rule of HIFU. The ideal nodule is not a too big nodule, completely intrathyroid, not too close to the neck vessel, recurrent nerve area, and trachea. So the nodule must have a special character. Not all the nodule can be treated by HIFU. This, I think, is the main limitation of this method. In these nodules, hot or cold, from theoretical point of view, ecotherapy can allow complete treatment in one session without anesthesia or session. When you have a nodule completely intrathyroid, theoretically, one session, completely necrosis, theoretically, but just special nodule. And to finish, hyperfunctional nodule is the ideal hyperfunctional nodule is that with TSH, just a little low normal TSH. Thank you very much.
Thank you, Dr. Barber. The talk is now open to discussion. Please go to the microphone and identify yourself.
I'm Mohammed Fauzi again from Cairo. Actually, I'm a believer of HIFU. I work HIFU by body back home in Egypt, not small parts. And I believe that HIFU is going to be the non-invasive treatment in the future. But concerning thyroids, I think in the future it will have a very important role. But I think the idea is to ablate the whole nodule. And to do so, it's best to put all the patients in conscious sedation so that you can have free hand of use of power, so that you can reach up to 50 watts. And then at that time, you can totally ablate it in a completely non-invasive manner. And this, I think, will give a very positive, in the future, very positive results.
Yes, this is true, but I think that if we do a minimal invasive treatment for a benign nodule, we mustn't have palsy of recurrent nerve. This is my opinion. So if you have the patients completely not without sedation, we can speak of the patient. So everything is well. Yes, thank you. I'm well. And you go on. So I am really terrorized, I don't know if I can say. I am fear that to have sedation, cautious of sedation, and when the patient, when the procedure is finished, to find something on the recurrent. So you are right, but I think that the first rule for minimal invasive technique is no side effect. This is my opinion.
I have a question, Daniele. Two questions. The first question is that I realize that the technique takes time, from 18 minutes to 60 minutes. What about if the patient moves, is not still? Does the machine readjust the target, or you lose the target?
Can I answer your first question?
Yeah.
Yes, this is another problem. Every time the patient moves, you must move the unit treatment is it's a little difficult. It's a technique which a little difficult. The patient must be stay perfectly without moving. This is a problem. This is when the nodule is big, is a little bigger. This is a problem.
The second question is not a question. I agree with you. Probably all the minimally invasive technique, the best target for these techniques are two. One is the partially autonomous thyroid nodules, because we all agree, I think, in this room that the toxic nodule is best treated with the radioiodine treatment. It works perfectly. It's rapid, no pain, no risks. If you are good, it's okay. The second is the small metastatic lymph nodes that you find sometimes in the neck when the first surgeon is not done very well. And I think this is another area where all these type of techniques should develop.
Yes, of course. Regarding HIFU, there is not important literature about this kind, but I think this is a very important issue of these methods, yes.
May I ask another question? How long is the learning curve for this procedure, in your opinion?
Not so long, because in point of fact, you have a software which does almost everything. I think it's shorter than laser and radio frequency. I think it's shorter. I think it's shorter because software you must put, but not so long, not so long.
Okay. So, thank you.